everybody. We are on Explant Series part number 3. I'm just going to show you really quick of what I have taken for explant surgery, what I was prescribed. I want to focus on each of the medications that I was prescribed so you have an idea of what you're given. So as we can see here, we have the antibiotics. I was told to pick up at the pharmacy a couple of days before explant surgery, and asked to pick up an antibiotic, which is called cephaloxime. 500 milligrams capsule, which is instructed to take 1 capsule by mouth 4 times daily. The brand is Keflex, another name for that. So this is pretty much, as you can see, from having the explant surgical incisions, you are exposed to possibly have maybe an infection. So to prevent that, they're prescribing an antibiotic. So this is basically used for any type of infections that can be caused by bacteria, like for any type of possible upper respiratory infections, ear infections, in this case, any type of skin infection. So we're preventing any infection at the surgical sites. So that's why you're prescribed an antibiotic. Okay, and also it's also good for UTIs and bone infections. That's just something extra information I'm giving just to give you an idea. So this is antibiotics to prevent from any infection from your surgical sites. So this is just one medication that is for that. Also, it's recommended for this type of medications to avoid taking it with like multivitamins with minerals at the same time, because this will actually interfere for any the absorption of these antibiotics in your bloodstream. So it will actually lower the effectiveness of this medication. So just keep that in mind, not to take it with any vitamins with minerals. The reason why, like I said previous video, that I did not take this medication is due to the fact that I was developing previously rashes and dizziness. I did get this prescription just because I was thinking it was probably possibly before, but I don't want to risk any type of chances. So I did end up taking the oregano oil that like I was telling you about. And that's the link that I posted on the previous video, which I posted again for my Pinterest. It's something that you take instead of the antibiotics for those people that may have some kind of allergic reaction. So I just did not want to go to that route. Actually, I did get all these medications to really do a video on that for you guys to be more educated and more aware of the possible risks that you may have, right? So that's one thing that I would suggest, is also to have in mind that you can take any vitamins that you usually take. Make sure to take it 2 or 3 hours after antibiotics, just to kind of be safe on that. I usually instruct patients to do not mix medications or vitamins together, because that usually kind of lowers the absorption. So I do tell them that. The side effects too of this also that you may have, the common side effects is diarrhea, any GI symptoms like nausea and vomiting, may possibly have stomach pain. So that's one thing. And the drug class for these antibiotics is called the cephaloxime, just for anyone that would like to know extra. The next medication is called muscle relaxant. So another name is for this is the cyclobenzaprine, which is 5 milligrams tab, which prescription was 1 tab by mouth every 8 hours. Another brand name for that, it will be Flexeril. So this is a medication that is given for, especially for a type of surgical experience as far as our breasts go. It's for the area that was cut, I would say. It is obviously on the breast area, and you're gonna be having a lot of tightness and sensitivity on that area. And the use for this muscle relaxant medication is actually to improve any type of muscle spasms that is really common. So do not get afraid or worry about any type of feeling of like like, the feeling of the shocking feeling or the electrical shock, like most people might say, or the pins and needles. That's just a part of the that part of the feeling of a spasm. That's how it feels. So this medication will help to actually lower pain as well and tenderness, which it has a sedative effectiveness on this medication. So it causes to become sleep, like it makes you sleepy, right? So most people may take this at night. So since you're going to go to sleep, it makes you fall asleep better. And also, along, you are instructed to take a Tylenol with that, which there are no interactions known. So it's okay to take it with a Tylenol, in other words, okay? You can take it together. So the side effects for this medication, just keep in mind, causes what? Sedation, right? So avoid it obviously with any other alcohol or anything like that, because it will cause any type of respiratory depression. So just keep that in mind. Side effects for this also is drowsiness and fainting, and lowers blood pressure, dizziness, and blurred vision. So just make sure that you take it at night to be more safe, and also take it with Tylenol is no problem. If you're experiencing any pain and any discomfort like muscle spasms at night, so it's best to take it at night. Okay. Another medication that I was given was a promethazine, which is an antihistamine, antiemetic. It's a 12.5 milligrams tab. It's one tab by mouth every 8 hours. A brand for this, name for this one is Phenergan. So this is a very, very common medication that is given to a patient after a surgical procedure. It's to help pain and to alleviate any nausea and vomiting, and also itchiness, possible for any itchiness, allergies, motion sickness, impossible runny nose or sneezing. So it's just one of those things that you just keep that in mind if you're, if you have experienced any type of allergies in the past and things like that. This is the one common medication that's prescribed for after surgical procedures. So side effects for this one is drowsiness, and also changes blood pressure. So it just kind of have that idea that it causes that kind of irregularity in your blood pressure sometimes, and causes drowsiness. So just remember that to take it every 8 hours, in case that you're experiencing also like the nausea and vomiting, if you're prone to that. So I just wanted to share that with you. Also, just want to go back to this one really quick. I'd like to mention that do not take these medications with any like herbal supplements, because most people like to go to the homeopathic route. So like if you decide to take like St. John worts, for example, and just remember, if you take that with this medication, and you may experience a type of serotonin syndrome. Is an adverse effects that you may experience of like an extra production of serotonin levels, which it causes a various types of not pleasant symptoms or side effects, like shivering. You may have muscle rigidity. When you experience insomnia, you may have like a elevated blood pressure, maybe confusion, restlessness, and sweating. So that's kind of the symptoms that it may cause if you mix it with herbal supplements. I tell all patients, do not, you hear me? Do not mix it with other, like I said, vitamins, for example, herbal supplements, anything that you want to have on the side and you don't tell the doctor, and then you're going to see the consequences after. You don't want to even go there. So you have to take it super, 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 super serious of taking it just under very strict instructions, because you may see the adverse effects that you don't want to, experience. So just be careful on that, okay? So let's go on the bottom here. Here we have is the any pain. Okay, so the ones that you experience pain, and the ones that are really like, okay, I want to make sure I take my pain medication, I don't experience no pain. In my case, I did not take no pain medications, believe it or not. Actually, I was okay with just having my how you say, my non-pharmacological ways, as far as like the deep breathing, walking. That's one thing that they're going to tell you, to make sure to be mobile, like move the body once you, not on the first day of surgery, but the following day, you make sure to move the body, so it can help you also with your circulation, with pain, with management of pain, and deep breathing, relaxations, meditations, anything that can help you with control your pain. Go for that. So the Percocets and other ones, it's actually basically a mixture of a medication between oxycodone, which is a narcotic, and it's an opiate, which is 5 milligrams, plus your acetaminophen, which is a Tylenol, 325 milligrams. All together makes a Percocet. Something for you to know. So that is just to take a 1 tablet, usually by mouth, every 6 hours, as needed. Just remember that, as needed. Okay, so you're the only one that would say, okay, I may need pain medication if you're not able to tolerate. Okay, but then you have to keep in mind that these medications may cause especially a lot of constipation after surgical incision. So you gotta keep that in mind, that you may experience that. You may have experienced lightheadedness, maybe nausea and vomiting, drowsiness, so dizziness. So just be careful not to drive while you take these medications. Okay, just keep that in mind. Also, you can take a Tylenol. Like I said, you can mix that with you can take it with your muscle relaxant. Like I say, there's no interactions, which is recommended for a night. If you want to take it at night for pain management and to be able to sleep better, go ahead. Like I said, I was able to manage my pain. Everyone is different. Do not compare yourself with other people that has taken different things, different routes. Everybody has their own way of healing, right? In the last portion of this video, I want to talk a little bit more about what other things are offered by your surgeon. Every doctor, remember, every doctor is different. So in this case, my plastic surgeon, Dr. Deb, was offering different services on the side, which is a nerve block, a banana bag, and an arnica. You'll probably wonder, what is going on here? I don't know what this means. So nerve block is pretty much, it may last for it's usually a procedure where they inject like an injection of type of how you say, a numbing medication that is like, they place it actually near your specific nerves that to lower your pain in certain parts of the body. So the doctor may know where to inject, and that's how I usually heard about that and learn about that. So it's just pretty much to manage your pain treatment and management. So it's an anesthetic, and it's also like anti-inflammatory injection. So just keep that in mind. It's something that may last possibly for 2 to 3 days. It all depends of the doctor or what instructions they'll give you, but that's what I know. I did not have any of these. I did not have the pain medications, and I did not have the extra things that they offer. So this, like I said, this is all up to you. This is only your choice. The next thing they also offer is the banana bag. These are the actually popular IV fluids that they give to people for, actually it's popular for alleviate symptoms for hangover. So this is an IV fluid that pretty much balances out your electrolytes. This is full of vitamins and minerals, and usually contains like thiamine, folic acid, magnesium sulfate. And it is to pretty much correct your nutritional deficiency that you may have and chemical balance. So it's just pretty much for that, to alleviate any type of deficiencies that you may have at the moment after surgery and stuff like that. Also, the last thing is arnica. Why did I take it? It's because you have to all keep in mind, ladies, that whoever has thyroid history, or your mother might have a history, or anybody in your family, and you are prone to have a risk to develop any type of thyroid issues. I have thyroid nodules. It's something that I have to take it super, super, super serious. I'm very conscious of what I eat. I'm very conscious of what I take. So arnica, unfortunately, based on what I have discovered and based on what I research on peer review articles, is that it does fluctuate your TSH levels, which is your thyroid hormone. So I do not want to mess with that. So I do want to just go ahead and not take it. So that's my own choice, and that's my medications that I was told to pretty much pick up at the pharmacy and prescribe from Explant Surgery, and those are the extra things that you are able to choose from what you would like to choose. This is actually extra from your payment for your surgery, so it all depends on the surgeon. It may be all different and how they manage all these things, but I just want to give you an overall of what medications I was prescribed. And that will be all for Explant Series Part 3. I hope you learned something today. Bye. Thank you.